Hi, I'm Dr. Suvarchala, Scientific Director with ZIVA Group of Fertility Centers in Hyderabad. Today I would like to share some information about fibroids which affect the uterus, thereby bringing down the fertility chances of a woman. What are these fibroids? Where are they predominantly seen? And what are the effects they have on fertility potential of the uterus? Let us take a look at them now. Now, fibroids are nothing but muscular masses. It's the growth of a muscular mass inside a uterus, outside of it, at various positions, which can determine, as in the location can determine whether it is going to have an effect on the fertility potential of the uterus. So let's take a look at the different kinds of fibroids which could be present. Let's start from the outside portion. If there is anything which is outside, and does it have an effect on the endometrium of the uterus? I hope you are aware of the machinery of the uterus. This is the uterus. Here is where the tubes are connected. It's not in the picture, but the tubes are connected there. This is the cavity. It is the endometrium. This layer is called the endometrium. That's where the embryo implants and the baby grows. So this is the endometrium. This is the cavity of the uterus. This is the cervix, which is the opening. It is the opening. And this is the entire vagina. So this is the basic anatomy of the uterus. Now let us take a look at where the fibroids could be present. If the fibroid is present on the outer wall of the uterus, it is called a serosal fibroid, and these fibroids are usually non-effective on fertility, as in they do not have an effect on fertility because they are on the outside wall of the uterus. They do not affect the inside endometrium, which is the most critical for implantation of the embryo. Now let's go a little bit inside and we can see the intramural fibroid. This is present within the wall of the uterus. Now you can see that it is not inside the endometrium. Therefore, this kind of uterus also does not have an effect on the implantation potential of the endometrium. Yes, the size does matter. Yes, the symptoms will matter. If the size is too big, it may be a little painful. The fibroid may cause a lot more bleeding. But of course, generally for our fertility potential, if it is present within the walls, then it does not cause much damage. Now let's look at submucosal. It is present within the layer of the endometrium, as in it is still inside, but it is protruding inside the endometrium. When you look at this kind of fibroid, which is submucosal, it is going inside. This kind of fibroid is extremely, I would not say dangerous, but I would say harmful for implantation of the embryo. That is, it brings down the implantation potential of the endometrium because it is going inside the endometrium. Now, the size matters, the location matters. Now, if it were to be here, this is where the embryo generally comes down and implants. You can see that it has invaginated inside the site of implantation. Therefore, it brings down the implantation potential. So, these kind of fibroids, the submucosal fibroids, are extremely critical and they have to be located properly under ultrasonography. The submucosal fibroids, like I said, are the most important. If they were to be present at critical junctions, then the implantation potential comes down. If you have been diagnosed with fibroids, the symptoms for you could be heavy bleeding, bleeding between periods, or short durations of bleeding, and a lot of discomfort, as in stomach pain and back pain and general body pains and all that. So if you are suffering from fibroids, if you have been diagnosed as having fibroids inside your uterus or outside of them, and you want some kind of a treatment, you're also looking at becoming pregnant, you want to consult for better treatment options, please phone us on the numbers that you can see on your screen. Come down, talk to us with your reports. If you don't have a report, we can do the scan for you. Thank you.